Hello, and how are you? My name is Winnie Barawa, and welcome to our today's session on Health Policy Triangle. If you're new here, this is a channel that focuses on lectures, lessons, and expert interviews pertaining to healthcare. If this is your first time joining us, kindly remember to subscribe and give it a like, and also leave us a comment if these lessons really meet your anticipations. But also, if you've been following, we are doing a series on health policy, and I would like, if you wish to learn more, view our playlist on health policy and planning and get to learn more about it. Otherwise, stay with me all the way as we talk more about health policy triangle. So the health policy triangle is made up of four parts, and in these four parts, we have the actors who are in the middle of the triangle, and these actors are individuals, groups, or organizations that can have an influence on the policy. And then in the triangle parts or in the areas, we have the apex, where here we are made of context. And then on the base, we have the content and the process. So these four parts play together, rather they bring out major components that have a great impact when it comes to development of the health policy framework or developing of the health policy documents. So because each of them plays a role, or each of these parts play a role into the having the final authentic document that is the health policy document. The first part of the health policy are the actors. And in this part, this describes to be actors is anyone or those individuals who can make or influence policy. And normally they are the center part of the policy framework, or rather, they're the central part of the health policy. They can influence this policy in a positive way, or they can also influence it in a negative way. Now, who are these individuals or organizations or whoever it is? So an actor could be in terms of a stakeholder, or could be any person that can have an influence on it or can make this policy. So it can include government, it can include companies, it can also include individuals who have influence at different levels. For instance, these actors could have influence at the local level, they could have an influence at the national, regional, or even at the international levels. These are different levels of leadership, different levels of influence. But remember, in all these levels, there are different parts of intertwining or different parts of influence that these people can have. So they are important to be part of the network because you can use them during consultation level and also when you want to decide on a policy at different levels. So it's advised that when you're doing policy development, you be able to know who are the actors, because these are the people that you will approach when it comes to consulting and getting the right advice or advisory input when you're developing that policy. So actors basically have a key role, or they have a key impact when it comes to the policy framework. And the second part is the context. So this context refers to factors that may have an effect on the health policy. And these factors could be broad. It could vary from political, economic, all the way to social. And these factors have different definitions. For example, factors like situational factors are looking at situations such as war, drought, or even earthquakes. Now, during war, we should be having policies in a government or policies in our society that provides what are the security guidelines in terms of war. Let's look at drought, where there's scarcity, there's no rainfall, there's no supply of enough food. There's need for policies that can guide the community on how to access basic needs in such a moment. Look at earthquakes also. These are situational or situations that can precipitate the need for policies that needs to look into such crisis moments. Then there's issues of structural factors. Structures look at how could be in the community or in the government or in the setups bring some states of injustice, or how are the rights of individuals adhered to or checked on. Talk of payments and wages among healthcare workers. Do we have differences in terms of gender equality and inclusion that leads to workers migrating? Do we have such a huge pay gap in our workers that some of them are not satisfied and they wish to move or migrate to other areas? What are the structures in place when it comes to this healthcare that can affect or can influence the health policy? Then the other bit is cultural factors. And with cultural factors, we can describe them as way of life or people's way of life. Like, how are they doing things? How are these things leading to different effect on how they believe on situations? Are there ethnic practices that are leading to poor service access? Look at things like female genital mutilation. Do we have such communities practicing such factors that can lead to a government either developing protective policies against women or providing laws and governance that can eliminate harmful traditional practices? And the third part of our health policy framework is the processes. Now, processes refers to ways in which the policies are initiated, developed, formulated, communicated, and even evaluated. Now, I've done a whole video on this where we're just explaining how the policy process happens, rather the policy cycle, and you can view that, you can watch it so that you can have a clear understanding of what we mean when we say health policy processes. So it provides the step-by-step method that should be followed when it comes to developing the policies. Now, in some instances, the policy formulation processes are so bureaucratic, they are so complicated, they tend to delay, and we end up losing fairness and justice for the people who are affected. So the health policy process is very basic. It is provided with the beginning stages of problem identification, followed by agenda setting. We go to have the policy formulation stage, then we have the policy adoption, we go into policy implementation, evaluation, and then we finalize at change. Now, looking at these different stages, you don't need to think everybody will follow this, because in some places, some people are having very long procedures on how to formulate policies. In other spaces, it is so delayed or it is so bureaucratic, or others basically don't even know what it means to conduct a health formulation process. So depending on the stages followed and depending on the complicated nature of the health process, we can have health policies that are not meeting the needs of the community, or they're not communicated well, or they're not developed meeting the needs of the population that you wish to cater for. And this brings us to the fourth component of health policy, which is the content. So what do we mean by the content? Content is the substance of a particular policy which is detailed in the constituent parts. For example, the content in a policy could be highlighting the objective of the policy. It could be highlighting the method of implementation of the policy. And these are key parts because they're going to guide, you know, they're going to guide the outcome, they're going to guide how we're going to implement this policy, they're going to guide us on how to work around the different components and proponents of this policy so that we get to have positive impact. But now this content is supposed to be specific, it's supposed to be simple, it's supposed to cater for each and every nitty-gritty of the needs. And so we are told content is supposed to be detailed so that it can provide us with the aims and the means of implementing this policy or bringing this policy to life. So if the content is not clear, if the content is not understandable, if this content is not measurable, sometimes when you give it to be implemented, the policy, chances are it will look complicated, it may look haphazard, and people may not have the urge to actually implement it and bring it to the latter. So it's very key that the content in the policy is very clear, because that is going to influence how the policy framework can be implemented. And this brings us to another part where we talk about the components or forces that shape our health policy. So this diagram summarizes key parts or key areas that shape the health policy. And in the middle here, We have the health policy process, that rather how the policy is formed. And again, I have done a whole video on this. Please check on the playlist on health policy. It's there. You can just read and listen more on it. So the steps are simplified here, where we have the problem identification, agenda setting, checking for alternatives, policy choice, implementation, and then you can be able to do an evaluation. But now there are different factors that can influence this policy, okay, which is the center part. So there are issues like values, like what do people believe in? Because values are going to guide us into knowing what people hold dearly, what people describe as respectful, what people describe as fairness, dignified, and all that. So the values of the people can actually shape how the policy goes. Do you uphold integrity? So do you uphold equality and equity? So if you're developing a policy, these are aspects that you will look into. Then there's this bit of policy analysis. So the policy analysis is how detailed have we been able to analyze our policy and put into place each and every component that is affected by it. Then there's aspect of advocacy and activism. Look at groups that have come into the forefront to spearhead policy changes and ask for better guidelines for the purpose of improving people's human rights or lifestyle. We also have around presidential powers, like who is in power, who's president, which values does the president hold, what are his priority in terms of health. All these come together to affect the health policies at that particular time. Then we've got politics. So politics, these are people who have direct influence on the policies in our community, and these are people who participate in legislature or in the parliamentary sit down. So with politics in place, it's automatically going to have an impact on the policies, whether positive or negative. And the other bit can't forget is science and research. With the research, this brings in data. And we're saying if good research is in existence, then we're going to have good data that can influence our policies. But if data on health policy is very minimal, it really brings out an aspect where we don't have enough information to positively develop on our policies. Then there's media. Now, media is a channel of communication, and with media, you can either spread good news or you can spread bad news. If people use the media channels to spearhead negative thoughts around a given policy that has been developed, high chances are the members of the public will not be encouraged. They won't even feel the need to practice this health policy that is in place. Then we have interest groups. And in interest group, I would like to look at it in the sense that this could be stakeholders, and stakeholders are people who have a particular interest in the policy. So if you have stakeholders who have a key interest in the policy, it means you're going to get good support towards this policy. You're going to get people who are committed to ensuring that they implement this policy in the right formats and in the right correct ways and with the right commitment. So that makes even the policy to be easy to be productive, to meet the needs of the people, and to see that it is productive enough. And this brings us to the end of this lesson. If you enjoyed our lesson, don't forget to subscribe, please. That's number one. Share it in our platform and also comment. Do you like it? Are there areas you wish us to improve on? And then give us a like. So thank you so much for staying all the way to the end and see you in our next lesson.